that may be disturbing. Parents are advised that these images may not be suitable for young children.
Before the break, our investigative producer Leslie Marcus took us inside the black market of plastic surgery, where coaches and recruiters use social media to aggressively market discounted cosmetic procedures in Mexico. We heard from 4 women who all went to the same surgery group and ended up in the hospital with life-threatening injuries and infections. Joining us now is Nora, whose aunt died following her plastic surgery in Mexico. And Nora, I'm very sorry. Can you explain what happened to your aunt?
My aunt went to Tijuana to get plastic surgery. My mom called and she's like, your tia Irma went to Tijuana to get plastic surgery and she's dying. So, you know, there was family that was already on the way. They were already there, so I was in contact with them. And I was asking them, like, okay, what are the doctors telling you? What's going on? And they weren't getting any answers from anybody. They weren't allowed to see my aunt. They told us that my aunt's, she was in a coma, and it was induced because she was seizing, so they needed to stop the seizures. As the days progressed, we didn't see any improvement. We weren't getting answers. There was a lot of red flags going on. So I talked to everybody that was there, and I was like, we need to get her out of here. We contacted an organization that sent an ambulance to the clinic where my aunt was at, and we brought her on to the border. And from the border, we had paramedics that took us to San Diego Hospital. And as soon as they put us into the emergency room, I was in the paramedics, so I was allowed to go in the room with her, and I kept hearing doctors say brain dead. She didn't get enough oxygen, and I'm thinking, this isn't the information we were given in Tijuana. What's going on? So finally, once the doctor, he put me to the side, and he's like, you need to contact your family for everybody to get over here, because you guys need to make decisions. We had to call family from Florida, from Texas, that if they wanted to get there in time, they had to make the appropriate reservations to make their way over here. And they did. The whole family was there to say goodbye to her. But that's technically what happened. As I was doing more research as far as what happened, the doctor that operated on her, he wasn't even certified to perform that type of surgery.
Clearly, without anyone knowing it, she was in dire straits. And I'm just trying to get a sense for the facility. What was that facility like?
So the facility was not your typical hospital where if someone's in critical condition, where they're fully equipped to tend to that person's medical needs. And when I got to the facility, I won't call it a hospital, but when I got to the facility, I was like, what is this? So, you know, with my aunt getting CT scans and they were doing blood transfusions, they had to bring everything from outside into the facility. I was like, this facility is not fully equipped to take care of my aunt.
Did you ever learn her cause of death ultimately?
So when we got to San Diego, they told us that the brain injury was caused because of lack of oxygen. So when I heard the doctors talking about how they didn't even put the tubing in right, I was like, my aunt went without oxygen for who knows how long, you know? And I find out that the surgeon that performed on my aunt, he's still practicing on women over there.
And Leslie, I'm curious, in your investigation, did you find out anything about how these facilities are accredited or how physicians are accredited vis-a-vis these types of surgeries and this type of social media recruitment?
So in Mexico, I did find that there are 2 sites you can go to. One is to see if the doctor is certified in the surgery that they're performing, and the other one is to see if the facility is in fact accredited. Now, a lot of the women that I spoke to, they didn't know who their doctor was, so there's that out the window. But the ones that did, I put their name in there, and they weren't certified for plastic surgery, and the clinics they went to, those weren't accredited either.
And I just want to take this moment to clarify that we are not implying that there are not well-suited doctors in Mexico or any other country in the world that aren't able to do these procedures. The issue here is going to a facility with unaccredited providers. I won't even use the word doctors because we don't even know if these are doctors, and that's what's scary to me, that some of the most basic things, if they're not recognized, can lead very quickly to death and untoward outcomes. And Nora, we are so very sorry for your loss. And coming up, the same surgery recruiter that recruited Nora's aunt also recruited others, and we're going to meet one of them when we return. Some of the untoward practices of surgery recruiters that are going online and convincing men and women to cross the border and go to uncertified clinics to be worked upon by people who are not even certified as doctors. We're now about to meet another victim, Chris, who joins us in the audience. And Chris, it's so hard sitting here listening to Nora's story about her aunt. You personally were convinced by a surgery recruiter. In fact, the same one that convinced Nora's aunt. Can you tell us a little bit about your journey and when you started to notice some red flags?
The moment we got to the facility, you know, it just seemed something wasn't right. The nurses had dirty scrubs. The sheets were stained with blood. The biggest red flag was for me was that the nurse didn't wear gloves while taking my blood to test my blood to make sure I was okay for the surgery. And then seeing the operating room just scared me because I hadn't had surgery in the United States and it was nothing like it.
So then what happened? Tell us about your experience.
When I woke up after surgery, I woke up in a puddle of blood, of my own blood. An hour after that, the nurse came in the room and told me that I needed to shower. I needed to get in the shower to clean myself. And I told her that I couldn't. I was too weak to get up. She refused. She took me in the shower, dragged me in the shower, and threw water on me to wash the blood off of me.
But I don't care what surgical procedure it is, you wait at least a couple of days for these incisions to close to a certain degree so they're sealed so that you can't have tap water potentially getting into these fresh incisions.
Can you explain what happened next?
The next day I was released from the hospital, from the clinic. It wasn't even a hospital, it was a clinic. And a few days after that, I had a really high fever and my body was going into shock. I didn't know why. So my family took me to the hospital and doctors told me that I almost went into cardiac arrest and I needed about 4 blood transfusions to survive. I was in the hospital for 2 months. And they had to cut the side of my butt and my leg to save my life.
In this whole experience, did you try to contact the recruiter or your surgery coach? And then what was the experience like with that?
In the beginning, she told me that the whole surgery went perfect, so she doesn't understand why I'm having issues. Once she found out that I was in the hospital, she cut all ties with me. She stopped answering my messages, my phone calls to my family members, and she pretty much blocked me from social media just so I won't say anything about my experience online.
Well, what procedures did you have done, if I can ask Chris?
Yeah, I had a Brazilian butt lift and I had a 360 lipo. So they transfer all the fat to my butt.
So that explains, why they did a major liposuction on Chris, and obviously she lost a lot of blood in the course of that large volume. So real serious, potentially life-threatening procedure being done by people that have no right to be doing this procedure in facilities where they're not prepared to deal with complications.
It sounds to me, when you're describing your story of basically being forced into the shower to get water to rinse off the blood, I'm assuming you had to go down there and give them probably the mortgage on anything in your life, probably gave them a massive cash payment, right, to do this?
Yeah.
And they're trying to turn that room around. They're trying to get you, I'm guessing, to the side so they can bring in their next victim.
Chris, I know you spent a lot of money on this surgery, but 2 months in the hospital, that was back here in the United States?
This was in LA. I have over $200,000 of medical bills at this point.
$200,000.
And you paid $4,000 for the procedure originally.
Paid $4,000. They sold me a dream, and now I'm in debt.
Can you touch a little bit on that dream they sold you? Because I know you were following the surgery group for a year and religiously looking at their Snapchats, looking at their Insta stories, their before and after pictures. Talk about how alluring that group is and the women that are posting these pictures.
Right. They tell you that you're going to look perfect, that you're going to have the curves, you're going to have the sex appeal, you're going to have everything that you want, that a woman wants. And for that type of price, I mean, who wouldn't do it?
Exactly.
Right?
So Chris, then tell us in contrast, what has your actual recovery experience been like for you?
I was out of work for over 3 months and my butt is never going to look the same. They told me I can never get plastic surgery in that area because I can get an infection again and that will spread through my body and will kill me eventually. I was very depressed for a long time, but I had to get myself together and move forward and make sure I share my awareness of my experience because that's going to save lives. At the end
Thank
of
you
the day.
for sharing. And I know that you've been through so much, but truly, we're just so happy that you are alive and here with us today.
Thank you.
And a lot of people are going to hear your story. Coming up, we're going to meet with a doctor known for creating curvaceous bodies here in the U.S. who's going to reveal the hidden risks of these complex procedures. Coming up, when women are willing to risk their lives for this look, I'm as a layperson saying, okay, I feel like you guys are taking your profession too far. Then, gathering intel on medical tourism.
People are taking information off the internet and making life-threatening decisions.
That's coming up